AMPYRA, a potassium channel blocker, is the first oral therapy indicated to improve walking in patients with MS.
This was demonstrated by an increase in walking speed.
In healthy individuals, neurotransmission occurs through propagation of action potentials or electrical impulses along myelin-coated nerves. The myelin sheath that coats the nerve is formed by an oligodendrocyte cell that wraps tightly in multiple layers around the axon. The high resistance of the myelin sheath prevents the electrical impulse from leaving the axon. This, coupled with the sheath's weak ability to store an electrical charge, allows for rapid conduction with little energy used. This makes the myelin sheath a critical component for axonal conductance of electrical impulses. A hallmark of MS is the loss of this protective sheath, a process called demyelination. Demyelination causes an uncontrolled loss or leakage of intracellular potassium from the axon. This results in a change in action potential. When the electrical impulse arrives at a demyelinated segment, it becomes diminished. This results in either slowing of conduction velocity or inability to sustain repetitive impulse discharges or conduction failure. The mechanism by which dalfampridine, the active compound of AMPYRA, exerts its therapeutic effect has not been fully elucidated. Dalfampridine is a small, lipid-soluble molecule that crosses the axon cell membrane. Once in the axon, dalfampridine blocks the open potassium channels, greatly reducing the uncontrolled loss of potassium. As a result, there is an increase of the action potential and improved neuronal conduction.
AMPYRA was effective across all 4 major types of MS disease course. In clinical trials, AMPYRA was effective in people across a wide range of disability, including people who can walk without an assistive device, people who use a cane or a walker, and people who occasionally use a wheelchair.
Important safety information to follow. The use of AMPYRA is contraindicated in the following conditions: history of seizure, or moderate or severe renal impairment. AMPYRA should not be taken with other forms of 4-aminopyridine, 4-AP-fampridine, since the active ingredient is the same. Patients should discontinue use of any product containing 4-aminopyridine prior to initiating treatment with AMPYRA in order to reduce the potential for dose-related adverse reactions, including seizures. Seizures. AMPYRA can cause seizures. The risk of seizures increases with increasing AMPYRA doses. AMPYRA is contraindicated in patients with a prior history of seizure. Discontinue AMPYRA use if seizure occurs. Renally impaired patients. AMPYRA is contraindicated in patients with moderate or severe renal impairment. Creatinine clearance less than or equal to 50 milliliters per minute. The risk of seizures in patients with mild renal impairment, creatinine clearance 51 to 80 milliliters per minute, is unknown, but AMPYRA plasma levels in these patients may approach those seen at a dose of 15 milligrams twice daily, a dose that may be associated with an increased risk of seizures. Estimated creatinine clearance should be known before initiating treatment with AMPYRA. Urinary tract infections were reported more frequently as adverse reactions in patients receiving AMPYRA 10 milligrams twice daily compared to placebo. The most common adverse events, incidence greater than or equal to 2% and at a rate greater than the placebo rate for AMPYRA in MS patients, were urinary tract infection, insomnia, dizziness, headache, nausea, asthenia, back pain, balance disorder, multiple sclerosis relapse, paresthesia, nasopharyngitis, constipation, dyspepsia, and pharyngolaryngeal pain. The risk of adverse events, including seizures, increases with increasing AMPYRA doses. No additional benefit was demonstrated at doses greater than 10 milligrams twice daily. There are no adequate and well-controlled studies of AMPYRA in pregnant women. AMPYRA should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Clinical studies of AMPYRA did not include sufficient numbers of subjects aged 65 and over to determine whether they respond differently from younger subjects. Safety and effectiveness of AMPYRA in patients younger than 18 years of age have not been established.